Safran. The last time the country had such a major focus on healthcare was, of course, back in the early 90s, 92, 93. What confidence does the society have that the outcome will be different this time around?
We are much more confident this time because the last time, the truth is, the system wasn't as broken as it is now. Secondly, now most, if not all, the major leaders are calling for the same thing, which is universal access to health care. That was not the case in 1993 and 94. So as this problem has gotten worse, more and more of the voting public recognize they are at risk. So we are very confident that if we go about this in the right way, we can build a kind of critical mass of support. The Society is proud to be a member of the National Coalition on Healthcare, the largest coalition advocating for healthcare reform and universal access that we've ever had. And at the table is big labor, big business, not-for-profits. So it represents people from all walks of life. So we are optimistic. And before we take the next question, I would like to acknowledge a wonderful person and Honorable Paul Rogers, who's joined us here. Paul, welcome. Over 2 decades of distinguished service in the United States Congress earned him the moniker of Mr. Health. And it's that kind of leadership that we hope we can get moving forward to shape public policy. I think the key point in answering the question you just asked, we need to seize the opportunity. The American Cancer Society is a trusted organization, and everybody is concerned about the cancer problem. If we can get everyone to see the broken healthcare system through the cancer lens, they're going to demand change.
Any questions in the room? I've got one for you, Dr. Wender. The American Cancer Society has long been a research-focused organization. Does this campaign mean less focus on finding cures and/or treatments?
We are not backing off in any way from our the history and the commitment that we've had throughout our entire existence in promoting education regarding prevention and early detection, or in our commitment to navigation for patients. In fact, we're accelerating our work in helping patients navigate through the cancer problem, and we are certainly not backing off in any way our commitment to life-saving cancer research. In the budget that we've just approved, we've maintained and in fact increased that support. We're not new, as Greg mentioned, to the area of paid advertising. We've recognized the power that can have. We've made a decision every year of how to strategically use those dollars, and we feel we've made the right choice now. We need to educate the public about the fundamental central barrier that must be overcome. That is a lack of access to care if we're going to keep progress going in the cancer fight.
Any questions in the room? If not, I have plenty here in front of me. Dan and John, I do believe this was also related to the first question about evaluating proposals, but similarly, it hasn't been explicitly asked yet, does the Society or the American Cancer Society Cancer Action Network have a point of view about what the right fix is?
We have our principles, and we will be using our principles as our guidepost as we evaluate, but we do not believe that there's a single way to solve this problem. And we are interested in looking at many different proposals that are out there. What we are committed to is making sure every American has access to quality health care, and that this is not a barrier for them. And so as different proposals come forth, we will be looking at them under the terms of, are they available, are they adequate, are they affordable, and are they administratively simple? I think one of the contributions we can make as the American Cancer Society and the American Cancer Society Cancer Action Network is that I think everyone agrees that it needs to be available to all Americans, but I think one of the things that has not been talked about enough is the adequacy of the coverage. And I think the story that Raina shares and that millions of other Americans share about they were insured but they got cancer and then they found out that they didn't have adequate coverage to cover the numerous visits they need to make to the doctor, to cover the drugs that they need, to cover all of the things that are required when you get a cancer diagnosis. That is a wake-up call to people, and we do not want other Americans to face that situation. We believe, and the evidence shows us scientifically, and John can talk about this in greater depth, that in fact, without access to adequate health insurance and access to quality care, we will see people, and we are seeing people, die needlessly from cancer because they're diagnosed too late. And that is not right, and it's something that we are committed to fix. We want to join in a national movement from the Cancer Action Network perspective to bring Americans together to demand our leaders to make the change. And John, you can add to that.
There's absolutely no question today but what, for the same amount of money that we're now spending, every American could be covered with health insurance. And it is, and there's more than one way to get that done. We believe let all flowers bloom, and together with a national dialogue, we can come up with the best solution. We, meaning the American Cancer Society, will not be determining what that solution is. We are offering to help in any way we can. Certainly we would allow our tools of evaluation to be used by any responsible party who wanted to develop a serious piece of legislation. At the end of the day, there's something else different today, and that is cancer is potentially the most preventable and the most curable of the major life-threatening diseases facing Americans today. We have to have healthcare reform to change or transform that potentiality into a reality for all people.
Dr. Wender, this is a question, interestingly enough, that we talked about over breakfast this morning. We hear all the time that patients come from overseas to get the best cancer treatment in the world here in the United States. Does providing access to everyone affect the ability to continue to offer such high-quality care?
Well, we're very proud, and the American Cancer Society research and our efforts and our advocacy on the Hill have been a major part of achieving that stature, where the finest care in the world is available to in the United States. The problem is it's only available to a fraction of the people who live here. Our goal of this access campaign, in some respects, can be stated very simply. We know how to win the cancer fight. We've proven the principle. We know how prevention, early detection, and improved access to treatment and delivery of that treatment translates to what we're now seeing, a decline in age-adjusted cancer mortality rates. But we're not going to realize the potential, as Dr. Seffrin just said, if we don't take the steps necessary to make sure that that very outstanding high-quality care is available to everybody in the country. That's what this access to care debate is, and our education campaign is all about.
John, you and Dan will want to take this one. After the ads finish running in the near term, how does the Society and ACS how do they keep momentum going, and how do we prevent issue fatigue?
We will be working across the country, and this is the beginning of a campaign, not the end of a campaign, and this is also the beginning of a long haul. We see the activity from the Cancer Action Network perspective of building over time. The ad campaign that the Cancer Society is running is a first step to educate the public. The Cancer Action Network, as its sister organization, will be actively out engaging the candidates. We're working, as I mentioned, with other large groups like AARP, the Heart Association, Diabetes, the Alzheimer's Association. Our volunteers are out in those early states asking questions. Are you covered? And they're asking specific questions of the candidates going forth. I mentioned that from there we're going to be launching a nationwide bus tour. This bus will be shrink-wrapped and tour every state in the lower 48. We'll be going from place to place. We'll be handing out voter guides. We'll be asking the candidates questions specifically about access, as well as about the other issues which I outlined in my remarks earlier. And we'll be making this a priority across the country. But we don't see that as the end of the road either. Once the election is over, hopefully we'll have a new Congress, we'll have a new president, we will also have new state legislatures and new governors, and we see this fight across the country at every level being played out, and so we'll be actively engaged using our evaluative tool and our principles to actually talk about enacting reform and changing the system. This is a process that takes time, but we're committed to remain for the long haul. John?
Dan covered it very nicely. I would only add one point, a fine point to this. Another thing that's different today than 1993-94 that's very important. We clearly consider this a bipartisan issue. But we now have the American Cancer Society Cancer Action Network, which is a 501c4 organization. So unlike in 93 and 94, we can not only ask all candidates at all levels where they stand on cancer issues and on healthcare reform, we can turn around and tell people what they said. So the American Cancer